Hi everyone, my name is Elizabeth Fadaunsi. I'll be presenting my soap notes on a case I encountered last week with one of the patient, and why this is kind of interesting is the age in the complaint. So, and also my clinical site is a women's health place. So basically, we um, do more of like pap smear, um, do like pelvic examination. They do treat some urinary tract infection, and some other reproductive infection or other reproductive health issues. So starting my sub note is the ID is Miss J. Clinic client initial, she's age 65, female, Caucasian. Date of birth is January 1, 1957. She's married. So CC, our main complaint is she's here for a pap smear. This HPI, starting with the HPI, Miss J is 65-year-old Caucasian woman with a medical history of hypertension, hyperlipidemia, type 2 diabetes. She came to the clinic alone with a complaint of recurrent blood spots in her undergarment and abnormal vaginal discharge. She reported that some months ago she had same complaint, and she went to visit our primary care physician, and they did test. She had abnormal pap smear, but she didn't follow her because she was given a referral to a gynecologist, but she never followed up. But because of the case keep happening, so that's why she's here on this visit to do the pap smear again, and now look into the case. She said there was a discharge, and she denies any chest pain, palpitation, any difficulty in breathing at first. So on current medication, she's only on hypertensive medication. She's on lisinopril 20 milligram, dosacin 2 milligram. On a diabetic medication, she's on metformin 500 milligram POBID, and for the hyperlipidemia, she's on Lipitor 20 milligram PO at bedtime. Past medical history, hypertension, hyperlipidemia, and type 2 diabetes. Allergies, none. Immunization, she's up to date. She received Tdap recently, and she received the COVID vaccine, both the first shot, second shot, and the booster. Surgery, none. Family history, she said her mother is 88 and with a history of high blood pressure, and also her father is 89 and with a history of hypertension, diabetes, and hypothyroidism. Social history, she's married. She retired as a receptionist in the school. She has 4 children. She has 2 grandkids. She denies smoking. She doesn't smoke. She doesn't drink alcohol. She doesn't use any substance or recreational drugs. She reports just occasional wine taking, maybe during festive period or anything. She said the house is a low floor building, and she's able to walk around and she's okay. And there's pool which is gated. So on review on system, generally she appear good. There's no she doesn't asking her the question, no fever, no chills, no night sweat, no weight loss or weight gain. And she said no headache, eyes is okay, no blurry vision, neck is no cramping, no pain, no ear problem, no swelling, no nose bleeding, no itch, no stuffy nose or sneezing, mouth, no bleeding, gums, no wounds, no sore throat is clear voice, no sore throat, chest, no chest pain, no palpitation, respiratory, there's no cough, there's no shortness of breath. Also, GI wise, I asked the patient, no nausea, no vomiting, no diarrhea, no constipation, skin, no rash, there's no itching, there's no abnormality in the skin, musculoskeletal, everything seems right. She uses a walker to walk, but her gait is fine. She's steady. Genital urinary she complained of abnormal vaginal discharge, and that's why she's here. She observed sometimes blood spots in her undergarment. Okay, breast no tenderness, there's no bumps, that one is okay. And neurological wise, there's no she doesn't feel fainting, there's no loss of consciousness at any point in time. In psychiatry, she's good, there's no insomnia. So vital signs when she came: 148/92, respiration is 18, pulse 88, temperature 36.7, XPO 200%, BMI 31.6. For the head, when I examine physical assessment, head, there's no problem. Respiratory, lungs are clear, there's no adventitious sound. Cardiovascular, there's normal sound. GI wise, a BMI is above the regular index. So, but the abdomen, all four quadrants, is the bowel sound is present. There's no hypoactive, and there's no hepatomegaly or splenomegaly. The breast is okay. In the genitourinary, there's no. When I checked in the we did pelvic examination, and which is visual inspection of the vagina and the cervix. So we use the speculum to insert. Just we took a sample because we had to redo the pap smear. We took sample, and we did I check. There's kind of a little bit blood stain around the cervix area, so we took sample that was already going to be sent to the labs. So on this note, my differential diagnosis: one, I'm going to be thinking cervical cancer with the ICD code of C53, because cervical cancer is like abnormal growth of the malignant cells in the cervix, and it is caused by abnormal growth cancer of the squamous cells. And it's in every stage, and a woman needs to check if there is any abnormal bleeding notice. And also, cervical cancer is regularly caused by infection with the HPV or other things like sexual partner, cigarette smoking. But in her case, she's 65, she's married, so probably be like maybe looking towards cervical cancer, which is my differential diagnosis, and that's my final diagnosis. My other differential diagnosis may be UTI, maybe urinary tract infection, maybe she's having more than one man, but we're not too sure. ICD code of CMN939, because she mentioned sometimes urine issues, so I'm probably thinking of UTI. Then also my differential diagnosis, I would say pelvic inflammatory disease, PID, because of the discharge and the odor. So these are things that we're gonna test and see on examination. She felt a little bit pain while we're doing the bimanual examination, feeling the ovaries and everything. So that's what I'm saying can be PID. So my plan is gonna be pap smell test that we're doing. We're gonna be carrying out the HPV test. We're gonna be taking biopsy. We took a sample, we sent to the lab and see what's going on. Will be discussed. Medication at this time, there's no medication required. We're just gonna wait for the pap smear test to come back and the biopsy result findings, and I'm just gonna educate the patient on what was gonna happen when we found abnormal tests, and education on consistent for her to follow up and be able to see the gynecologist and follow up with the case, and to monitor the amount of discharge and odor if anyone happened in before we get the result, and if there's any other thing that is so bad like bleeding, losing amount of blood that is so much, call 911 and you go to the emergency room. So we're gonna give her a follow-up appointment to come back in a week. So by that time, the result would have been out, and we'll be able to know what the final diagnosis is and the medication plan to be done. Thank you so much. That's my case.